All right, welcome to episode 10 of Talk Mental Health with Logan Noone. I don't always have my shit together. This episode is going to be a little bit special, being that it's numero 10. It's just me, ladies and gentlemen. Just me, kind of like that first episode. Why I wanted to make this episode all by myself is sometimes through my work, I sometimes even feel I put a fake persona out online. What I mean by that is I'm someone who lives with bipolar disorder. Obviously, I'm a fairly open advocate about my experiences. I've gotten into medical school. I have my own podcast. And what I mean by all of this is that I think I kind of project this image that I always have my bipolar disorder managed perfectly. I get these messages from people really all over the world. How do you do it, man? How do you maintain? How are you in perfect recovery? How do you not have any symptoms? And that's not true. I absolutely have symptoms of bipolar disorder. I sometimes still feel depressed. I sometimes still feel hypomanic, even manic at times. But over these 7 years of having this disorder, at least diagnosed as having this disorder, I've gotten much better at being aware of my symptoms and really what's going on. So this episode, I want to talk about that, how I maintain that, and how I really stay motivated when I'm not doing great. So really the origin of this podcast comes from an Instagram post that I did, about 3 months ago. So I'm going to read that Instagram post. If you don't follow me on Instagram, I highly suggest you do. I post the coolest stuff. You can follow me at Logan Noone. That's Logan. If you don't know how to spell that, my God, just stop listening. Noone, Noone. No one smushed together. All right, here's the post. As a mental health advocate, much of my time and energy is spent trying to improve the mental health of others. However, over the past 3 weeks, I've grown a better understanding and appreciation of burnout. I was diagnosed with bipolar disorder 7 years ago and been able to drastically improve my management of my mental illness. Yet, since starting medical school, I've put academics in front of my mental health. My first year of med school has been great. So far, I passed all my classes, even lost 30 pounds since matriculation. I simply assumed this would translate to proper management of my bipolar disorder. In reality, I've been ignoring insomnia creeping back in my life. Since the start of school, I struggled with quality sleep, especially surrounding exams. Fueled by stress and too much caffeine, my sleep has deteriorated over this past year. Over the past month, my insomnia reached an apex from my lower back injury. I couldn't even lay normal in a bed from the pain. Even after minor surgery from this pain, I wasn't able to exercise regularly until the wound healed. The past month of poor quality sleep brought back feelings I felt in the deepest moments of my depression. It was unnerving. Did I lose my ability to manage my illness? Thankfully, I behaved differently than 9 years ago. Rather than turning to a bottle of whiskey to put me to sleep, I turned to my friend, Richard, pictured in this photo in the Instagram post. I turned to Chad and others who were going about what was going on. They all encouraged me to seek help. Yesterday, I had my first therapy appointment with Dr. Joyce Daly, our local school psychiatrist. I made calls to local psychiatrists to book an initial appointment. Gone are the days I'm ashamed to use the mental health system. Gone are the days I deal with my struggles alone. So that was a post I made about 3 months ago. I was in my spring semester, my second semester of my first year of medical school. And if you couldn't tell, I was extremely struggling. But prior to that post and prior to really that pivotal moment I was referring to, I ignored much of my mental health symptoms during my first year of medical school. Medical school has been tough, and you hear this all the time, it's so stressful, yada, 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 but I think a lot of people are hesitant to really voice specifically what is going on in their life. And in medical school, I put really my academics in front of everything. In front of my exercise, in front of my sleep, in front of the quality time with my wife, because I did not want to flunk out of medical school, and thankfully I didn't. I came close that first semester. It was extremely hard, but I didn't. So thankfully I did pass, and I'm very thankful for that. but my mental health continued to deteriorate. And really, this injury that I'm referring to is nasty, okay? Look up pylonidal cyst or pylonidal cyst. I still don't even really know how to exactly say this phrase. I probably should learn because I'm a medical student, but whatever, I know how to spell it. Pylondial. My God. It's essentially a cyst on the top of your butt crack, ladies and gentlemen. Isn't that a pretty image? It was absolutely terrible. Every time that I moved, this thing would just hurt so bad, and it got progressively worse throughout the entire spring semester. I couldn't sleep, I couldn't exercise, I could barely even put on pants because right on the tip of my tailbone, essentially where the top of that butt crack is, was that cyst, and it must have been pushing on some nerve. It was excruciating pain. Absolutely awful. So I was able to get this, drained and this cyst handled. However, I wasn't able to exercise for about 6 weeks, and that's really when I felt my deepest moments of depression. And I looked back and I realized, wow, I have been ignoring my mental health. I'm a phony. I'm out here projecting mental health advocacy, trying to push people to seek out care when they need it. However, I'm not even doing that myself. I need to get it together. So, I just want to really remind all the listeners, even though I am a mental health advocate, I still have mental health challenges. I am not perfect. Even though I take my medication, I still have symptoms of bipolar disorder. So, I think being that I've had bipolar disorder for this long, I think I sometimes got a little bit lazy with the management of my mental illness. When I initially was diagnosed, I saw a therapist every other week. I meditated every single day, and I was much better about my exercise routine. But through the transition of abandoning my career in finance and becoming a pre-medical student and eventually becoming a medical student, getting entrance to medical school, I got a little bit lazy about all this stuff. And I simply assumed that my accomplishments would bring mental health happiness. They do. However, it's not long-term. It's a short-term happiness. When I got into medical school, that was the closest feeling I've ever had to feeling really that true manic moment again that I felt in 2011. I was over the moon. I was just having the time of my life. It was unbelievable. And this time it was warranted. I got into medical school. But a week after, I was worrying about, my God, how am I going to pay for this move all the way out from Connecticut to Yakima, Washington? How is my wife going to find a job? How am I going to be able to afford this? How am I going to be? And my mind would just race and race. And that accomplishment of getting into medical school, it certainly did bring me happiness, but it's not long lasting. I really feel there's no such thing as long-lasting happiness. It's really this fleeting emotion that we're going to have sometimes, and other times you're just not going to feel it. I really think the way to have consistent mental health moods is by being consistent with your own practices. And that's something that I really got away from through over this past year. My first semester in medical school, I really think the thing I was ignoring the most was sleep. I would justify taking an extra cup of caffeine. I normally would just have a cup of caffeine in the morning, but I was having sometimes 3 to 4 cups of coffee a day just so I could stay energized to sleep a little longer. Or to study a little longer. And what I mean, of course, without even me saying this, my sleep was garbage. I could not fall asleep. And then right when I woke up in the morning after maybe 4 or 5 hours of sleep, I was chugging that double coffee, just trying to wake up, become alert and ready for my classes. So while this did provide me more study time, it certainly wasn't high quality study time. And it was really, really challenging. In addition, a big part of my managing my mental health challenges from bipolar disorder, but even really the stress of just managing the demands of medical school is spending quality time with my wife. I really think going through this first year of medical school, it's obviously hard for me as the student, but I think it's even harder for the spouse of a student in medical school. They're all alone. Their life is essentially put on hold while their spouse is out chasing their most wildest dreams of achieving medical school. And I still sacrificed spending quality time with my wife for studying. I wanted to make sure that I passed these courses. And obviously, just losing that quality time with my wife really was mentally health taxing. She has such an ability to recognize my moods, and with her not being able to be around as much, it was really, really challenging for me. And she's really a great way for me to distress. But it wasn't until that injury that I really knew that I had to make some drastic changes in my life. I'm gonna have to make some sacrifices to my studying. I'm gonna have to sacrifice studying to get extra hours of sleep. I'm gonna have to make some sacrifices to studying to spend quality time with my wife. It's really, really important in order for me to maintain my mental health. Now, also, after I got over this butt cyst, really in the midst of dealing with this butt cyst, I knew I kind of had to get back to the basics of handling my mental illness. I needed to get back to meditating every day. Once my body could allow it, exercising at least 20 or 30 minutes every day, just to tire my body out. I find that by exercising, I literally feel less anxious. I feel if I can tire my body out, my mind can't get so wound up on things. So let's get into first finding a therapist out here in Yakima. What I did is I just kind of went through my school's counselor program, and I was able to get quickly connected with one of our school counselors. It was really quick and easy. But I've now done a few sessions with her and realized I want to try just some new people. It's not that I had any bad kind of experiences with this therapist, but I had a break of 4 years of really seeing a therapist consistently until now. And it's really, every time I saw a new therapist, I compared them to that initial therapist that I saw right after being diagnosed with bipolar disorder, right after leaving the psych ward. And I think it's not the new therapist's fault, but none of these new therapists really added up to the amazing therapy that I had years and years ago. And I've actually continued to try to seek out therapy with this person, but he's located in Massachusetts and I'm located out here in Yakima, Washington. My insurance just simply does not cover him. If I did, I would have to pay it out of pocket, which I have done a few times, but also it's just challenging through video. I want to be a psychiatrist one day who does do a lot of video medicine, but there is obviously a lot of challenges that come with that. So I seeked someone out here in Yakima, but then eventually I realized I wanted to go with somebody else, and I'm just kind of playing the field right now. I'm going to go see a few different therapists and really find someone that I really, really click with before I make that commitment of going every other week like I used to. Because I know this second year of medical school is going to be very, very challenging as well. At the end, if you didn't realize this, at the end of your second year, most typically in medical school, you take step 1 board exam. And what that really means, it's all of the things you've learned in your first 2 years of medical school. It's an 8-hour-long multiple choice test. Does that sound intimidating? Are you pooping your pants a little bit right now? Because I am simply talking about it. So it's certainly going to be stressful. I know that over the next year, I'm really going to have my mental health game on point. I'm going to have to seek out a consistent therapist that I actually really connect with. I'm going to have to focus on finding that quality time and making that quality time with my wife. And like I said, I need to have a consistent sleep schedule. Not 4 to 5 hours a night. I need to focus on getting at least 7 minimum. The last part of this is I needed to find a psychiatrist. And I want to kind of share this story because I think a lot of people don't really realize how difficult sometimes finding a psychiatrist can be. So I'm out here in Yakima, I'm making calls. I tried to get referred into this one psychiatrist. He had no availability, so I got his assistant, a psychiatric nurse practitioner, very well qualified. Great. First available appointment she had, 5 weeks out. Okay. So they call me. She says she wants to have the documentation from my psychiatric experience in Charlotte Hungerford Hospital in 2011. She wants the records. Can you please come into the office, sign a release of information so you can do this? Sorry, gonna have to hold that call, Jeremy. So she wants me to come in the office. She wants me to sign it so she can get access to this paperwork. So this summer, I was very financially stressed. I was working all the time. I now have my second job. I've already switched jobs once this summer because the first one was really difficult. So this summer, I've just been busy trying to work as much as I can, save up money for my wedding this fall. Now, I know that might sound like a lame excuse for forgetting to go into her office to sign the release of information, but I forgot. It's just something that I kept putting off, and I never did it. So, I was able to make an appointment with this psychiatric nurse practitioner 5 weeks out from that initial call. 2 days before our appointment, I get a call, "Hey, buddy, you forgot to sign that paperwork. I'm going to have to cancel and reschedule your appointment until you do." I was pissed. I was frustrated. I had not seen a psychiatrist in literally probably 4 years. I was so annoyed. I was just like, man, you're making another barrier to entry, making this so freaking harder. I hate the mental health system. This is so stupid. This is why I became a doctor in the first place, because I want to make barriers or reduce the barriers to entry for my patients. Yeah, I was mad. I was irate. I wanted to go seek out psychiatric care, and here they are. I have my insurance card. I have the money ready to pay for the appointment. No, sir, we can't see you. We don't have the information for your account. I was being a whiny little beep. But after a few days of whining, I realized, would I ever go to an orthopedic surgeon without my x-rays? No! How can an orthopedic surgeon do his job to the full extent without the x-rays? This is ridiculous. So I tried to equate that to my psychiatric information that I was supposed to get from the hospital. So long story short, I eventually did. I was able to book that appointment with my psychiatric nurse practitioner. And, before we make any medication changes, she just really wants to see, is this necessary? We're doing a long-term sort of assessment of my moods. In addition, because I take valproic acid, I did have to get blood drawn to make sure my levels, aren't totally killing my kidneys and liver over here, as well, and see if that valproic acid level is still in the typical therapeutic range. So really, that's where I'm dealing at this. I wanted to just make this podcast really just to show listeners I don't always have my shit together. I know from the Facebook, from the Instagram perspective, we all kind of portray our life like it's perfect. It's just we make these wedding photos. We do all these perfect poses. We do all these Instagrams and podcasts and whatever may have you. But we don't always show the vulnerabilities and the things we're struggling with. And so that's why I wanted to make this podcast today, because if you are listening to this podcast, I'm assuming that you have sometimes mental health challenges. That might not mean you have a diagnosis. That might not mean you ever even really talked to an official therapist or psychiatrist, and nor do you need to, because I think we all have mental health challenges. But I don't want you to look at me and think, wow, that guy has it totally together. I wish I could live up to him, because I don't. And know that you still can accomplish wonderful, amazing things that you really dreamt were never possible without perfectly managing your illness. You're never going to be able to perfectly manage your illness. I'm going to end on this. I remember one of the most favorite things my therapist, said to me years and years ago was this. I was in his office and I was just complaining. Dave, when is my anxiety going to go away? My anxiety is getting better, but it is not going away. It is so annoying. I just can't stop thinking about this. Blah, blah, blah. Logan, calm down. Your anxiety will never go away. You'll be able to minimize your anxiety. You'll be able to develop strategies and tools to deal with your anxiety when it arises. I can promise you that we can work towards minimizing your anxiety. However, I am never going to promise you that this is going to go away completely. You will probably always have some means of anxiety in your life that may not pop up for a week, a month, maybe even years. But these kind of things never go away completely. And that sat with me for a long time. And I really just think bipolar disorder management, mental health management, whatever it may be, you're never going to get it perfect. It's just trying to take this day by day and working yourself through and trying to remain balanced, trying to remain motivated, and also just remember that perfection isn't real. Thank you so much for listening. Please tune in for episode 11, where I interview one of my classmates who dealt with postpartum depression. Thank you.